Welcome to Getting Your Dream Smile with Cosmetic Dentistry. This is where we discuss and help patients get what they want in a smile while being totally informed. Whether it is porcelain veneers, bonding, whitening, or Invisalign, you'll find out what is best for your situation. Everything you should know, where and who to see, and all the costs involved. Stay tuned.
Welcome back to Getting Your Dream Smile with Cosmetic Dentistry. My name is Sabrina, your host for today, and I'm joined with Amy as well. I work with Dr. Eshom to inform the public about the best ways to achieve your best smile with cosmetic dentistry. Our podcast discusses the benefits and what you need to know as a patient about cosmetic dentistry. Today we'll be talking with Dr. David Eshom, who's been practicing cosmetic dentistry for over 25 years as a credentialed cosmetic dentist from the American Academy of Cosmetic Dentistry. Dr. Eshom loves sharing his recommendations when it comes to getting a great smile in the most minimally invasive way possible. And today we'll be discussing when patients should choose Invisalign over porcelain veneers. Let me introduce to you all Dr. David Eshom.
Hello, everybody, and thanks for tuning in to our podcast. And I feel lucky today to be podcasting with these two lovely ladies. One we'll be saying goodbye to, who is Sabrina. And she's going to be off to dental school after next week, and so we're so excited for her. And then we have Amy, who is just joining us, who's going to be taking over Sabrina's position. And she's going to be podcasting with me in the future, so I'm very excited to be here with Amy too. And I can't wait for Sabrina to see our podcasts while she's in dental school. So these two ladies are very special, and I feel lucky to be sitting next to them. But for you today, I want to give you information about getting cosmetic dentistry and knowing when cosmetic dentistry is right for you. And each day, patients come in to me wanting a better smile and almost willing to do anything for it, including some patients wanting just to get porcelain veneers and grind down their teeth. And so we sympathize with these patients that feel kind of trapped in their bodies with an ugly smile. And we want to help them out, but we also want to help them out without grinding on their teeth, if at all possible. So our approach is always that. And so today's topic of when you use Invisalign versus porcelain veneers, I think is a very important topic to everybody out there who wants to get a better smile and not feel trapped with an ugly smile. So,
well, I think that's great because I know that you're always here to help boost the confidence of these patients, and sometimes they don't know what procedures they want, and they just know what's the most common procedures, such as porcelain veneers and just destroying their tooth structure. But I'm glad that we're here to help inform them on what's best for them.
Great. Yeah, no, I'm glad too, and I know you ladies prepared some questions for me. So I'm ready to answer those as we go. And if there's anything else that pops up in your minds or my minds, we'll cover that too. We should be done in about 15 or 20 minutes. But I think this is actually priceless information you'll be getting tonight.
Well, yeah, we'll go ahead and get started. So my first question for you, Dr. Eshom, is how often do patients come in wanting porcelain veneers but end up going to Invisalign instead?
Well, because I'm pretty well known in the community, a lot of people come to me asking about how they can get a better smile. And I feel very lucky to be in that position. Most of them have kind of already made up their mind as to what they wanted because they've seen a friend or somebody else, get a new smile with porcelain veneers. And so they feel, well, God, I think that's the best thing for me. But really, there's a lot of things to look at when it comes to whether porcelain veneers are best for a patient or not. And so I'll be going over those today. And one of the biggest ones is, what are the condition of the teeth as they are individually? So they may not look good because they're crumbled up over each other, or there's spaces, or they're sticking out. But if the teeth themselves have good proportions and they're not broken down, then most of the time Invisalign can help them. So let me give you an example of some patients that have come in those circumstances and tell you a little bit about what we did for them. So I'll go to share screen here. And so there we go. So this is, a classic example of a patient that came to me, asking for porcelain veneers. As you can see in the big picture here, her teeth were pretty crowded and in the wrong place. The gum levels were uneven. The edges weren't even with each other. And then as you look further into her smile was really narrow. And so if we were going to be doing some porcelain veneers for her, we would probably want to lengthen these teeth. And for the people listening, you might just want to drop over into our YouTube channel to kind of see this. But this poor woman had kind of crowded teeth and a really narrow smile. And so if we did porcelain veneers for her, we would have to do something like this to level her edges. And then we'd want to bring her out on the sides so that she can have a wider smile. And then, kind of join it here with her cuspids. But that's a lot of tooth grinding for somebody who's probably in her late 20s. But when you actually look at her teeth and you look at the length versus the width, and then the condition of the edges, being all intact, they're not worn, the teeth are not brown or dark, there's not a lot of fillings in them. And so it just wouldn't make sense to do that. And so on the picture to the left, to the right on the right of the screen, we show Tanya, who is finished with that wide smile that we were talking about, with her edges all in the right place, with her gums in the right place. And her teeth look like porcelain veneers. They're so perfect, and her teeth were all there. All we had to do is move them into the right position for her to get the smile she wanted. And so I talked to her about not doing porcelain veneers, and I talked to her about being in a year of Invisalign, and we actually got her done in a little bit less than a year. I think it was like 11 months and one week. And then she got the smile that she was thinking of envisioning in her mind without having to grind on her teeth. So when you have teeth that are good in and of themselves, but just need to be moved, I kind of tell patients that that's like you have this beautiful furniture. Each one of your teeth is this beautiful antique furniture. And all we have to do is move that furniture around in the room, and then the room looks beautiful. So all we have to do is move your teeth around in your mouth with orthodontics, in this case Invisalign, so that you'll have a beautiful room too. And so respecting tooth structure and knowing what you can do with it to put it in the right place really makes a difference versus having to grind your teeth down.
Yeah, I'm glad that you said that, because that basically answered my second question, which was what would qualify a patient for Invisalign rather than porcelain veneers, and what factors should patients look for in their own smile when they're deciding what treatment they should want?
Well, let me show you a case in that sense, because we had a gentleman here a few years back, and he wanted porcelain veneers. Let's see if we can get our share. It's back. Share, okay. And then these are his teeth, and he wanted porcelain veneers. And these teeth don't look much different than what Tanya wanted. And but he was getting married in a month, and he wanted his smile now. And after many minutes of discussion with him back and forth, and him making a decision after a day or two, after I informed him about what would be needed in order to straighten his smile with porcelain veneers, he decided to go with porcelain veneers. And this is kind of what he looked like when we were done with his porcelain veneers. And that looked beautiful. And he was happy, and he got married with a big smile on his face and took great pictures with his wife and even came back to see us a few years later. But what I don't feel good about in his smile was the amount of tooth structure that needed to be removed in order to get this result. And so, again, you know, you listeners out there, this gentleman had very crooked and crowded teeth that were crossed over, and then we made them straight with porcelain veneers. But now I'm going to show the audience on YouTube how much tooth structure needed to be removed in order for him to get these porcelain veneers. And you can see I had to cut in between the teeth. I had to do laser gum recontouring to get his teeth to all line up and be the same proportions on both sides and to be straight. And then these are his upper teeth, and this how much had to be ground down for him. And so sometimes it's just not worth it to get this smile, but everybody has their own decision process. And in this case, this gentleman really wanted that smile for his wedding, and that was the choice he made. But it wouldn't have been the choice if he had more time.
So those are the sort of factors that you're balancing when you're choosing between Invisalign and porcelain veneers, correct? Like the length of the treatment, and then also the cost of the treatment with the physical money, but then also the cost of the treatment with the amount of tooth structure that you're losing, correct?
Right. When you do that kind of addition and comparison, those are great points, Sabrina, is that, you know, that smile for Cornelius was his name. That smile cost him about $35,000, $40,000, you know, and doing the lab work and doing the work and the workup and all that. And, but where we think about Tanya's case, where she had similarly crowded teeth, you know, that Invisalign treatment cost her $5,000. So 30,000 versus 5,000 is a big difference. Now Tanya took a year, Cornelius only took 3 weeks. But Cornelius, you're right, Cornelius paid one more amount, one more significant amount, and that was his tooth structure. He paid with this priceless tooth structure that he'll never get back, and that's going to destine him to have to replace these porcelain veneers after 10 or 20 years, because they don't last forever. No matter how well they're made, these porcelain veneers don't last forever.
And I think that's so important, because when you're choosing Invisalign, and let's say you go through Invisalign to straighten your teeth, you still have your full natural tooth structure, and you're using your own teeth, and you haven't lost 50% of it. Like, we've done studies, I believe you said that, you know, you're losing almost 50% of your tooth structure when you're choosing porcelain veneers over, let's say, Invisalign or even bio-3 veneers, which is another minimally invasive technique that we do.
Correct, correct. What are your thoughts, Amy?
I think that it's really cool that you were able to showcase the pros and the cons of Invisalign versus porcelain.
Great. You know, I know you're a student, pre-dental student at UCSD, and so this is all new to you. So to Sabrina and I, it's really nice to see your opinion, because this is things that, you know, you're not used to seeing every day like us, and so your opinion is very important. So I'm glad you had those thoughts.
Awesome. And I guess from there we can move on to the next question. And so that would be, what features should a doctor be looking at, and what should patients be recognizing in a doctor to create a smile that would fit their whole face? So especially when it comes to Invisalign consults, is there something that you specifically look over to create a smile that would fit their face and make them look amazing?
Well, good question, Sabrina. And the answer is the same whether you're thinking about doing cosmetic dentistry with restorations or whether you're doing cosmetic dentistry with Invisalign, is that you want to put together your smile design by putting the teeth in the right place within the person's face, and then within their lips, and then within their cheeks, and so that you get a nice wide smile. So whether I'm planning on doing porcelain veneers or BioClear U veneers or Invisalign, we start with the smile design, and putting the front teeth in the right place first is very important. So let me show you what I'm talking about. when it comes to that. I'll share the screen in just a second if I get to the right place. So again, back to that same patient, Tanya, this is where her two front teeth were when she came in and when she wanted porcelain veneers. So for the listening audience, one tooth is in front of the other. One is tipped back, and that one that's in front of the other, the front teeth, it's kind of like you would call a buck tooth, somebody with buck teeth. And in fact, it was so far buck that the edges of it weren't worn because she never was really able to bite into anything with it. And so when we did her smile design, we thought about putting this tooth further back, that buck tooth, further back, and then we thought about the one that's stuck behind and bringing that out and making it even. And on the right here, you can kind of see what that looks like when she was done. And so we start with those two front teeth and getting them in the right place in our plan. And then we go to the second most important tooth, which is her side front tooth. And we put that perfectly next to those other two front teeth that are in the right place. And again, this isn't done instantly, but it's done in our mind and in our plan. And that's what we call a smile design. Then we go to the third most important tooth, which are her eye teeth or her cuspids. And one was tipped in and one needed to be tipped out slightly. And so we put that in a nice wide position. And then we built her bicuspid right behind that so we can see it. And then her next tooth, her bicuspid right behind that so we can see it. So it gives her a broad smile on one side. And then we take that and we try to duplicate it on the other side so that she has a nice, broad, wide smile that is symmetrical when she displays her teeth.
I always like when you mention how you want a wide smile, because that's something that I didn't really think about when I was trying to think about what I wanted when I would correct my crowded teeth. And so what do you think is the importance of having like a broad and wide smile especially when you're planning out these cases?
Well, a lot of people think, oh, we want a broad, wide, symmetrical smile because it looks good. And it does look good, So you think of some of the actors and actresses that you like their smile. And if you look to the sides, they're usually nice and full and fills out their lips left and right. But the other important functional aspect of a wide smile, too, is when the teeth are narrow and tipped in, like Tanya's were here. They're tipped in. They're in. Oops. They're tipped in. They hit the lower teeth at an angle. They don't hit directly on top or directly vertically. And so over time, you see a lot more wear and fracture of teeth when those teeth are like that. It's kind of like if you're building 2x4s, if you're doing a room addition, you wouldn't tip the walls in. You want them straight up and down so that they can hold up the roof. And so it's the same with teeth. When you bite down, you want to bite down directly vertically rather than at an angle so that it protects them from wearing and fracturing. And so a broad smile is both aesthetically pleasing and functionally better for our patients.
Well, that's great, because I think that Invisalign is so amazing since you get to benefit your health and then how it looks, and you keep your tooth structure. So there's many benefits to Invisalign over just porcelain veneers, which is it's a quicker option, of course, but you will be sacrificing something that is irreplaceable, such as your tooth structure.
Yeah, you're exactly right, Sabrina. And I tell that to patients. Most of them come in wanting because they want straight teeth, right? Everybody wants straight teeth. Well, we tell them we not only give them straight teeth, and not only teeth that fit together well, but we give them a great smile. And so we try to give our patients three dimensions to the result: teeth that fit together, teeth that are straight, and teeth that look good. And when they come in for looks, I tell them, well, you no matter what, you're going to get not only looks, but you're going to get health, because the teeth are going to fit together and they're going to chew together and be more compatible with each other the rest of your life. But if someone comes in and they want their teeth straight and for health reasons, because they can't clean them or they're getting gum disease, we tell them, well, we're going to make your teeth straight, But unfortunately, you're also going to look better. And most people laugh at that, but you're going to get both benefits no matter what. And that, again, that's what's so great about Invisalign, is you get that great smile and you haven't lost any tooth structure.
Awesome. All right, I'll let Amy take the honors of asking the last question. If you would like to ask Dr. Eshom this last question.
Alrighty. So we were just wondering, we have talked about how Invisalign is so much better than porcelain veneers, and how porcelain veneers grind down your teeth and you want to keep as much tooth structure as you possibly can. But are there any cases where porcelain veneers are kind of inevitable in creating the smile that the patient wants?
There are. I mean, you know, a lot of patients come in, you know, asking for porcelain veneers, and I think you have this question in your mind, Sabrina, earlier, is like, what percentage of them do I talk out of it?
Mm-hmm.
And, you know, I always present Invisalign when I think it could be in the best interest of the patient. And even if they come in for porcelain veneers or any other procedure. And so we always present that, but, you know, it's probably about 10 to 20% of the people that come in for porcelain veneers seriously consider doing Invisalign instead of porcelain veneers. And I congratulate them. But there are some patients, as you said, Amy, that, you know, their mostly only choice is porcelain veneers. And let me give you an example of patients like that, and we can go over that. All right, so here on the screen for our listening audience is a woman that has generally nice teeth, but over time she had worn the edges off them. So the teeth are short, significantly short actually. And so if we were thinking about doing Invisalign for this patient, we would have to extrude her teeth, meaning move her teeth, her edges of her teeth down so that she'd have a nice curve to her smile line. And so, you know, these teeth would have to, as if you're watching on YouTube, need to be down here somewhere. And if you imagine, if we did that, that's going to expose her gum up here. And when you see this tooth later on, I'll show you another picture. This tooth is very square. A square tooth is a tooth that is the same width as it is tall. A beautiful tooth is rectangular. It's longer than it is wide. And so when we look at Donna's teeth, you'll see that when we restore them, obviously, that's them restored, sorry. Here we go. You could see that if I pull these teeth down, the gums are going to be way down here. And then if we decided to do gum surgery to lengthen them, then her teeth are going to be really narrow up there. And so it really wouldn't do her much good to go through orthodontics to pull those teeth down, do the gum lift, and then have to do porcelain veneers at that point because the necks of the teeth are so narrow. So we did do porcelain veneers for her, and this is the result. But we left her gums up where they were because they were in the right place, and we just lengthened her edges. And so this is an example of somebody that we wouldn't want to necessarily do Invisalign with, because we'd be doing it and then we'd be having a problem with the gums, and it just didn't make sense. It's better just to go straight to porcelain veneers.
Yeah, I mean, it looks great, and I can totally see where, you know, in the original pictures, it already looks like her teeth are straight, and it looks like they're pretty aligned, but the furniture may be a little bit off, and the porcelain veneers definitely help that.
Yeah, and I think that was a great case to explain that. I have another picture of someone where porcelain veneers were a better choice for them. And it was this patient where she had these tiny little laterals, and it didn't matter how straight we made her teeth, her lateral or her side front teeth were so narrow and small that they would never look right in comparison to her two front teeth. But again, on the screen, we show how much tooth structure needs to be taken away in order for me to narrow the central incisors and widen the lateral incisors, so she would have the right proportion to her centrals and her laterals, because a lateral incisor is about 70% as big as a central incisor, and the way her lateral incisors, they were maybe 50%. So we had to sneak a little bit away from her central incisors and add to her laterals. But in doing that, we took away, as Sabrina said, 50% of her gum tissue, or of her tooth structure.
I have a question about this case, and I was wondering if you would be able to use bioclear veneers to fix this. Is it possible to fix those proportions, or do you feel like this case really required porcelain veneers?
You could have done this with bioclear veneers, but whenever I go over bioclear veneers, and maybe we'll do this in a different podcast, is that I showed them the difference in the way they look in terms of not having translucency at the edges. And even though people can't see that from a social distance, this patient preferred porcelain because she wanted the translucency.
Got it.
So those are the instances that I think about, along with an instance where a patient wants her teeth, or his, I shouldn't say her, their teeth whiter than what they could be with bleaching. So if someone wants them Hollywood white and you're in your 50s and 60s like me, you're going to want, and you want, a nice shade, then it doesn't matter if your teeth are straight and they're the right proportions, you're going to need to cover them in order to get that whiteness. And so that would be the other situation where you wanted teeth whiter than what you can bleach.
Well, thank you, Dr. Eshom, for sharing your wonderful knowledge. And just as a summary message to all the listeners out there, just look at your teeth and see, do I have good furniture in my mouth? Could I fix it up without having to grind down on your teeth? And that's what we want to emphasize to our patients and to our listeners, that, your last option, or, you should always think about ways that you can fix your smile in a minimally invasive way. And do you have anything else that you'd like to say?
I was going to ask Amy if she had anything to comment on with her doing her first podcast.
Yeah, it was super cool to see how the difference between porcelain and Invisalign, because I was not that knowledgeable about it before this podcast. And so I hope that we as well as listeners learned a lot today.
Great. Yeah, no, and thank you, ladies, for putting this together. But yeah, it's important to get the right information when you're thinking about improving your smile, and not to go to somewhere where the only thing they do is one thing. The only thing they do is braces, or the only thing they do is porcelain veneers, or the only thing they do is general dentistry. You want to go to somebody that has all the tools, that knows about Invisalign, that knows about bioclear veneers, that knows about porcelain veneers, so that they can present to you the best possibilities for your case and for your teeth, or as Sabrina says, your furniture, to make sure your furniture gets in the right place and you end up with a great smile.
Awesome. Well, thank you so much, Dr. Eshom, and thank you to everyone who's out there listening. Be sure to subscribe to our podcast, Getting Your Dream Smile with Cosmetic Dentistry. And if you would like for us to talk about your smile in the podcast, you can click the link in the description, send a picture of your smile with your concerns, and we'll be sure to go over that in our podcast. Other than that, be sure to subscribe, and we'll see you in our next episode. Thank you.
Bye, everybody.
Thank you for tuning in to Getting Your Dream Smile with Cosmetic Dentistry with Dr. David Eshom. Be sure to subscribe to our podcast to be notified about future episodes. Click the link in the description to fill out a form if you have any questions on cosmetic dentistry or your smile that you want us to answer. See you next episode.